Hey y'all, welcome to my channel. This is Nana TheLockdNurse. If this is your first time to my channel and seeing any of my videos, go ahead and hit subscribe because I'm going to be putting out lots of videos. On this channel, I talk about locks, sister locks, micro locks, and also about the career of nursing and a bunch of things in between. So lots of good information. So go ahead and hit subscribe so you don't miss any of those videos, and also hit the notification bell so that you're updated whenever I put something new out, which I hope will be very helpful to you. So go ahead and do that. Today I'm going to be talking it's going to be a nursing video. I'm going to be talking about some very important things to know if you're considering becoming a nurse. Now, I've been a nurse for, let's see, 2011, what is this, 11 years, almost 11 years. So I have learned a lot over my 11 years as a nurse, and I am very eager to share some of that information with you. But today I was going to be talking about some important things that you should know or that you should consider before becoming a nurse. So let's get going. So the first thing I wanted to say about things to consider before becoming a nurse is that nursing is a very taxing occupation. You know, especially if you're going to be doing hospital nursing, which honestly is kind of the best thing to do when you're starting out. If you're a new nurse, or if you're in nursing school right now, or if you're considering becoming a nurse, obviously. Knowing how the hospital kind of works and learning all your basic skills in the hospital is very, very important. So I would highly recommend that that's where you start your career, in the hospital, where you get all your basic nursing skills, IVs, blood, medication administration, all that good stuff. It's very important that you have that solid before you move anywhere else, and the hospital is where you get that. Now, if you do hospital nursing, I mean, you're talking 12, 13, sometimes 14-hour shifts. You know, sometimes something will happen, somebody will code, or, you know, you'll get in a really complicated admission or something, and that's gonna run your shift. That can run your shift to be much longer than the 12 hours that we hope that our shifts always are. And so you're gonna be there for a while, charting, catching up on, you know, meds or whatever. And so just know, keep in mind that it's very taxing. You need to be on the whole 12 hours. When I say on, I mean mentally, physically, and in every way you could possibly imagine. So you're going to be communicating with doctors, family members, case management, occupational therapies, physical therapy, respiratory therapy. Especially if you work day shift, all these people are going to be coming to you all day, asking you about your patients, and you know, doctors are rounding, residents are rounding, providers, nurse practitioners, PAs are rounding. Everybody's going to be asking you for everything. So day shift, like I've said before, can be very, very taxing, very, very demanding. Night shift, not so much, but night shift has its own, you know, issues there. So, you know, don't think that night shift is much simpler. It is a little bit less hectic than days, but night shift can also be very, very taxing. You have to be engaged all the time. I mean, you have to be thinking all the time, especially if you're going to be working critical care like ICU, even progressive care. I mean, that just requires a lot of like constant like critical thinking and thought, and like, you know, thinking about the whole picture and asking questions. You have to be doing that constantly. You have to do that constantly anywhere you work, but especially if you work in critical care. And so one thing I think that's really helpful is that before you decide on going down this path, it would be really good if you could be a tech or a CNA or something like that. It's just to get the feel of the hospital, get the feel of the flow, get the feel of, like, you know, basic patient care, changing beds, cleaning up patients, stuff like that. Just to give you at least a little bit of something. Also, it'll give you a chance to really observe nurses and to see if that's actually something you want to do. So being a tech or a CNA, I think is invaluable. It's very, very, very helpful in order to help you decide if this is what you want to do. Now, the good thing about these long shifts, 12, 13, sometimes 14-hour shifts, is that most of the time, our full time for nurses is 36 hours. And so in 1 week, you would have to just do 3 of them. Whether you like to space them out or put them all together, at least every week you're going to have 4 days off or 4 nights off, however you're going to be doing that. And so that's at least nice. It helps you to kind of recover a little bit from all of the shifts that you've been doing. And it's a good way to kind of regroup and relax so that you're ready for when you have to go back. The second thing that I want to talk about, kind of tagging right along with that first point that I made, is that nurses work some funky shifts. There are day shifts, which are usually 7 a.m. to 7 p.m. Really, it's kind of more like 6:45 to like 7:30. Let's be real. You do huddle if your hospital or your floor does huddle. You do huddle, and then at the end you're giving reports. Sometimes it can take a long time. So really, let's just say 6:45 to about 7:30 is the real shift, either AM or PM. And so these shifts, they're long. But like I said before, you only have to do 3 of them in a week. Now, like I said, 7A to 7P or 7P to 7A, so day shifts or night shifts. There's some funky ones in between. Some people do evening shifts like an 11 a.m. to 7 p.m. or 11 a.m. to 11 p.m. When I was in clinical when I was in nursing school, during my clinical, there was a weird like 3 a.m. to 3 p.m. shift or 3 p.m. to 3 a.m. shift. I think that was mostly in the ER. I've never really seen that on the floor, but in the ER, they do some weird funky shifts. So that's definitely one thing to think about. Like if you feel like this is going to be really messing up with your circadian rhythms or with your body and stuff like that, that's something to really consider, because they're long shifts, but they and you can pick the shifts that you want. There are some hospitals that do rotating shifts, so sometimes they'll have nurses do a little bit of day shift or day shift for like 6 weeks, and then night shift for another 6 weeks, and then you go back and forth. Most hospitals that I've worked with have made you pick one. So you pick either a day shift or you pick night shift, and you kind of work that. And I think for me anyway, that I thought was better, because my body was a little bit more used to doing one thing and not having to flip back and forth. So just remember, nurses work some funky shifts. The night shift, that's definitely something to keep in mind. That's something you might be required to do. And then those weird like afternoon to early morning shifts, like the 3 p.m. to 3 a.m. or 3 a.m. to 3 p.m. But again, 12-hour shifts. You only have to do 3 of them a week in order to be considered full-time. So that's also a good thing. Next thing that I want to talk about nursing is that it is right now probably one of the most secure job fields that you could possibly get into. The reason for that is because all the baby boomers are, getting to that age now where they're needing all that care, and obviously there's a lot of them, and so the job security is solid. The other thing too is that a lot of nurses are going to be retiring, and so we're needing more and more nurses to come into the workforce. And unfortunately, also because of COVID and all the burnout, a lot of nurses have left. They've just left the nursing field, and so there's those of us that are left, trying to like pick everything up and keep everything going. And so we need definitely a lot of good, solid-minded people to come alongside with us, to work with us, with baby boomers that are going to need a lot of care from us. The Bureau of Labor Statistics projects that nursing, the career of nursing is going to grow 7% between now and 2029. So job security is solid. You will never want for a job. So that's a really, really good thing about nursing. Now, along with the job security, nursing also offers so many like little paths that you can take. So many things. You can get your master's. You can become a nurse practitioner. You can become an acute care nurse practitioner. You can become a primary care nurse practitioner. You can become neonatal nurse practitioner or a pediatric nurse practitioner. You can go to CRNA school and become a nurse anesthetist, and they are one of the highest paid nurses in the field. We're talking at the very least 6 figures, and so that's also that's obviously that's more school, but that's also some serious job security right there. You can become a psych mental health NP. If psych is your thing, becoming a nurse practitioner, a psych nurse practitioner is the thing for you. It is also considered one of the highest paid nurses out in the field. You can go into management if you like to manage people. You can become a nurse manager. You could be an educator, a clinical a clinical a clinical educator, or you can do lectures. If you get a your master's in education, you can. I know some nurses that have gone into the tech industry to do to be reps, like representative for companies like Medtronic and St. Jude, and doing research, especially with like devices like pacemakers, defibrillators, and stuff like that. Holter monitors. Nurses are needed in that field too. There's so many avenues that you can take. You can go ahead, you can get your PhD if you're into research, and get your DNP if clinical is your thing. And that offers obviously, a difference in salary, a difference in work hours, if that's something that's important to you. There's so many different avenues you can take when you get a nursing degree. That personally, that was one of the reasons why, because I had been debating between nursing and PA school, and that was like one of the main reasons why I chose nursing, was because I saw the flexibility. I saw how many different things I could do with a nursing degree versus a physician assistant degree. So nurses have a lots of paths that they can go on. So one last thing that I wanted to mention is that if you are considering going to nursing school and you don't have any like a bachelor's degree before you decide to go back to school to get a nursing degree, do not stop at your associate's degree. That is a good first step, but do not stop there. A lot of people get there and get comfortable and decide to stop, but I highly encourage and recommend that you go ahead and get your bachelor's. A lot of hospitals don't even hire nurses with associate's degrees that don't have bachelor's degrees. They only want bachelor's prepared nurses. That's kind of where the career, the kind of like the career of nursing is going now. They want to kind of stick with bachelor's prepared nurses, which, I mean, when it comes to like the nursing skills, there's really no big difference, but they want people that have had, the 4-year degree, because it includes like liberal arts and other things in addition to all the nursing things that we learn. So to them, I guess that's you're a more well-rounded person, I guess, if you have a bachelor's degree versus an associate's degree. So that's why they're starting to require that. So it's very, very important. If you absolutely if you want to start with your associates, do that, but then continue. Don't stop. Just go right ahead and get that bachelor's, because that is going to serve you very well in the end, because a lot of hospitals don't even hire associates prepared nurses these days. And that is it. I hope that I answered some questions. I think I thought up this list, and I was like, these are the kind of the things that I was considering when I was thinking about going back to nursing school. Things that I wish that I had known about nursing before I decided. If there's anything else that you guys are thinking of that you need answers to, if there's any questions that you have, leave them in the comments. Let me know. Go ahead and like this video, comment, obviously, leave whatever questions, like I said, and also hit subscribe, because I'm going to be putting out a lot more videos about nursing. If you're a nurse, or if you're considering becoming a nurse, I have lots of information that I can share with you. But I hope that this video was helpful, and hope to see you soon next time when I put out something. Okay, thanks. Bye.